Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 961st episode. Let's have the headlines of the day. According to the CDC, between 2% and 10% of pregnant women are impacted by gestational diabetes. According to a research, pregnant patients in deprived neighborhoods are more likely to develop gestational diabetes. Gestational diabetes may double chronic kidney disease risk, studies show. Pregnant women with diabetes, particularly pre-existing diabetes, are at increased risk of anxiety and depression, are at an increased risk of depression, mainly according to research published in Journal of Diabetes Epidemiology and Management. cfDNA sequencing enhances non-invasive early detection of gestational diabetes. Let's go to the topic of the day. एज यू हैव अंडरस्टूड, आज हम बात करेंगे जेस्टेशनल डायबिटीज के बारे में और इसके बारे में हमारे पास एक स्पेशल गेस्ट आई हैं हमें बताने के लिए, डॉक्टर अलका देशपांडे. Dr. Deshpande is an esteemed consultant physician recognized for her outstanding contribution to healthcare. A recipient of prestigious Padma Shri Award, Dr. Deshpande served as the former professor and head of the Department of Internal Medicine, along with being the chief of Antiretroviral Treatment Center at Sir J.J. Hospital in Mumbai. With MD and FRCP from London in internal medicine, she demonstrates a commitment to advancing medical knowledge. Specializing in thyroid disorders, diabetes, and infectious diseases, she has extensive expertise and has significantly impacted medical education and patient care. Her wealth of experience, coupled with a steadfast dedication to patient well-being, positions her as a beacon of excellence in the medical community. Dr. Alka Deshpande remains a sought-after expert, providing valuable insights and compassionate care in critical care medicine. So, welcome, Dr. Saab.
Thank you,
Shall we
madam.
start? I have a
Thank
host
you.
of questions, जो
Yeah.
कि patient who have all the questions have been sent mainly by patients. So let's start. Is diabetes more common in pregnant women nowadays?
See, nowadays, India, diabetes is like an epidemic in India.
Yes.
You know, 10 crore, more than 10 crore people are diabetic, more than 13 crore are pre-diabetic. So naturally, it will be reflected in women. What I am going to say is that there are some women who are known diabetics, type 1, type 2 diabetes, and they conceive. That is a different thing. But today we are discussing an issue which is gestational diabetes. This was first described in 1964 by Sullivan, who found that non-diabetic women, when they are pregnant, they have impaired glucose tolerance or they have high level of sugar, and which resolves after delivery. So to this he gave the name gestational diabetes. So gestational diabetes today, as per the ICMR survey and all, it's about 3.5% is the prevalence in our country. 1 in 25 pregnant women will have this gestational diabetes.
Okay. So can it harm the pregnancy if it is left undiagnosed or untreated?
See, in pregnancy, as you are an obstetrician, you know,
Yes.
it is the mother, it is the delivery and the fetus. All three are affected. So if there is a diabetes, naturally mother also will be affected. The delivery will be affected. There can be miscarriages or there can be some complications like hypertension, preeclampsia. For the fetus, there can be birth injuries or there can be a fetus, oversized fetus. Although it is oversized, overweight, it is his organs are not developed or matured. So it is like an immature fetus. So these will be the complication in addition to some other complications which are very specific like shoulder dystocia and birth injuries.
So how do we diagnose diabetes in pregnant women?
See, by definition, It is said to be detected during 24th to 28th week of pregnancy. But what I would advise, that all people who are planning pregnancy should undergo what we call nowadays is preconception counseling. So
Yes.
in the preconception counseling, all the doctors give them the advice that the parents, both husband and wife, both of them should be physically, mentally, psychologically, they should be fit and prepared to be parenthood. We do also some investigations, and we also complete the immunization process before pregnancy. But if that has not occurred, then we should do the blood sugar at 24 weeks in a woman. And depending on the blood sugar levels, if she was a non diabetic and if now the sugar is raised, we call it as gestational diabetes.
Okay. So, once we have diagnosed it, how do we treat it? By medicine,
No,
lifestyle changes, or directly to insulin?
no, see, gestational diabetes, if we go by definition, there is a international association and our Indian guideline. So that those guidelines says if the fasting blood sugar is more than 92 and 2 hours blood sugar is more than 140 in a pregnant woman between 24 to 28 weeks, she is a gestational diabetes. In India, it is not possible that we don't have laboratories at all the places. The woman may find it difficult to come, give the blood 3 times and bear the expenses. So, what we do, you give a 75 grams of glucose on empty stomach or on even after breakfast and take the blood at 2 hours. If the 2 hour blood sugar is more than 140, then it is gestational diabetes. This is called as a random blood sugar. And then we can do fasting PP. So the moment you find the fasting blood sugar is more than 120, then she needs insulin. But if it is between 92 to 120, this is treated by what is called as medical nutrition therapy. So here we can control her diabetes by giving nutritional advice to cut down on her carbohydrate. We also advise her exercise. And the best exercise for a woman is walking. She should not do aerobic exercises. She should not do any supine exercises. She should be, protect herself from imbalance and falling down because that may cause trauma. So, walking is the best exercise which she should do. And medical nutrition therapy, as we call it in our terms, is a nutrition which gives you, cuts down on the carbohydrate, on the fat, and maintains the weight of the patient with exercise. So in medical nutrition therapy, this 92 to 120, this group can be managed very well. If the blood sugar is fasting is more than 120, then please start insulin.
Right. Thank you. Thank you so much. Actually, patients are very scared of starting insulin. They feel that once they take insulin, it will be for always. It is not so, but still they are scared.
That is not correct because, first of all, let me clarify this misconception. The gestational diabetes is only during gestation and it resolves after delivery. Therefore, we call it a gestation. So it can't be lifelong. This is one. Secondly, if it is life saving, we have to take insulin. And third thing, nowadays there are so many devices that it doesn't cause pain or anything. And but yes, you have to take the injection. But if that there is no other option, you have to take it. Many people have such misconceptions about steroids also. But if it is life saving, it has to be taken. So if the
Very
sugar is more than 120, fasting blood sugar more than 120, in addition to diet, we give her insulin. There are oral drugs also, but their safety in pregnancy is not established. Secondly, madam, as you know, these people have morning sickness, they have vomiting, they are irregular in their food intake, the food intake is erratic. So these oral drugs are, harmful because they are long acting and therefore they will increase the sugar level, I mean the insulin level in the body, and the lady may go into hypoglycemia which will harm the child. So there are no oral drugs advocated during pregnancy. There are some trials which have been done with metformin, but American and European guidelines don't advocate metformin because it causes lot of nausea, and it is not inferior to insulin, but not as safe as insulin.
Correct. So, one viewer has asked us, are there any nature cures? Indians are very fond of nature cures.
What it is?
Cure, natural cure for diabetes.
Natural cure. I am not the person to opine on this. There is no natural cure as such. As I said, if the sugars are between 92 to 120, after the delivery, it will resolve. Even if it is more than that, even if the patient is on insulin, the sugar levels will come down to normal within 6 weeks after the delivery. After that, we stopped insulin. So it is only during the second and third trimester that we have to give, and people should not be scared because it is safe for the mother, for the child, and for the delivery also.
Another viewer has asked, can uncontrolled diabetes lead to abnormalities in the unborn baby, and how to detect these?
Yes, I mean, it is known that they cause unborn, I mean, the birth injuries are there, but even congenital malformations are there. It is very difficult to detect all the congenital malformations. Ultrasonography may be one of them. But these malformations, if there are malformation, usually the body will reject that child, and therefore you get large number of miscarriages in these people, and that is again a fetal loss. So when there is a fetal loss, it is quite a traumatic thing for the parents and other people. So it is better that we control it, because now we have the means of controlling it. So why refuse it? But I will not advise to go for alternate medicine. I don't have any experience, but if with insulin I am getting the best results, I have a good experience with it, it is a proven treatment, then why not take it?
Yes, exactly.
Yes.
So, can uncontrolled diabetes lead to problems of the growth of the baby?
Uncontrolled, yes, because there will be a lot of water retention in the baby. So baby looks large in size, baby looks overweight, but the organs are not developed. They are not mature enough. Now, when the baby is large size, naturally, as an obstetrician, you would advocate them cesarean section. So that will have its own morbidity with the mother and the child also. So it is better to avoid all these complications with a simple one injection of insulin.
Yes, yes, very
Yes,
right. And insulin injection nowadays they give in the pen. It is just
pen.
like
Yes,
ant bite to you.
yes,
So it
exactly,
is not much
exactly.
of a problem.
You
Exactly.
can easily adjust the dose. Just
Mhm.
like a ball pen, you just press it, and the dose is given in the subcutaneously. So it's very nice. Only thing I would like to caution here, that in pregnancy we can use rapid acting insulin, we can use Mixtard, but we cannot use the basal insulin like Glargine and Detamir. These are the new insulin. They are not approved by FDA for use in pregnancy. So it will be rapid acting human insulin.
Okay. And if the baby has grown large, will it affect the mode of delivery? A girl wants to know. Can
It
she
will
have a
affect the,
normal vaginal mode of delivery? Vaginal
madam, that
delivery
you
will be
have to
possible or
answer.
no?
That you have to answer.
यस तो टिल अ पर्टिकुलर वेट हम नॉर्मल डिलीवरी के लिए ट्राई कर सकते हैं बट इन बच्चों में क्या होता है अगर वेट ज्यादा होता है तो उनका सारा फैट यहाँ पर और स्वेलिंग होती है तो अगर सिर हार्ड होते हुए निकल भी आता है बच्चा इधर शोल्डर से फंस जाता है और हम उसे शोल्डर डिस्टोशिया बोलते हैं
Yes,
अगर हमें
yes,
खींचतान करके बच्चे को निकालना पड़े तो यहाँ की नर्व्स दब सकती हैं और बच्चे का हाथ का पैरालिसिस हो सकता है so to avoid all these complications, it is better to go for cesarean if the weight is more and the doctor is confident that you cannot deliver normally.
yes,
Right, ma'am?
yes. And again, with diabetes, suppose if she has also hypertension, then it is better
Yes,
to go for cesarean section rather than for vaginal delivery, because after all, every baby is a precious baby
very, very,
for
yes,
a doctor also, as well as the parents. So we
yes.
have to treat it properly. Yes.
Yes. So now a lady is asking that in case there is less growth of the baby due to maybe she has hypertension also with diabetes. So can this less growth lead to problems in the brain of the baby also?
It's not very well documented, but it can affect, because the only substance that the brain uses for energy is glucose. And therefore, if there are glucose carbohydrate metabolism anomalies, it can affect. There are we can't do control trials in the pregnancy. That is
No,
the
no, no,
problem.
no, no,
Yes,
not at all. Yes.
yes,
So they also want to know okay, if the baby is too big for the size, the age, and if the baby is too small, can this weight, the growth, can it be controlled after birth by the care of the mother?
yes, yes, definitely. Because in mother also the diabetes will resolve. The mother can do the breastfeeding, and then naturally we can take pediatrician's opinion. But the baby can grow normally after the delivery. Yes, that is one good
So,
thing.
yeah. And another thing, this you have already answered, you have already told about this, but a viewer wants to know what is the role of exercise in controlling diabetes?
We see, when we do the exercise, the sugar in the blood enters the muscles, because muscles, when they are exercising, then they need energy, which comes from the
Yes.
glucose. So, glucose from the blood enters the muscles. So, naturally, the blood glucose level will come down. So, even for other diabetics, exercise is very, very important. So, along with the diet, we tell them the exercise and then only the medication. So, the exercise will definitely help, and the simple and the best exercise for a pregnant woman is walking.
Yes, very rightly said, ma'am. So, a favorite question which all diabetics ask is, how can my sugar be high if I don't eat sugar at all?
People eating Karela also, their sugar is high. So there is nothing like sweet and bitter. Okay. The sugar is refined sugar, but sugar is carbohydrate, and carbohydrates are present in all the food items that we consume. More so also in the oil, the fats which are burnt. So they also, all these factors lead to overweight. Now these are, there are risk factors like family history, or there is obesity, or there is PCOD in the woman before the conception. So all these are the risk factors to develop diabetes. So before conception, they should take care of this, reduce the weight, be normal weight, and take care of themselves. Nowadays, there is so much of a health consciousness, but I think the
Yes,
doctors also should advocate to the newly married couple to undergo this counseling, get tested, and be prepared for the parenthood.
right. You are very right. Preconceptional counseling and
Yes,
preconceptional testing is the norm of the day, and those who follow it, I think they are very lucky.
and also
So, what?
preconceptional immunization,
Yes, right,
immunization of
right.
the mother, so that the child is
Yes,
protected.
yes, you're very right. So, what are the normal levels of blood sugar for a pregnant woman? Are they different from a non-pregnant woman? आपने बताया है, but I think they want to know again.
See, the blood sugar, normal blood sugar for a normal person, we take fasting blood sugar 80 to 110, and 2 hours 120. That after giving a challenge of 75 grams of oral glucose. Now, in pregnancy, 92 fasting and 120 postprandial. So, if the fasting is more than 120, that is definitely little more high. So, we should give insulin. But 92 to 120, we should manage the patient with medical nutrition therapy. We are only cutting down their carbohydrate. We are allowing them all other food. Carbohydrates and fats are cut down, and exercise. With that, we can control it. There is no problem.
There's another question. A lady is asking, why does diabetes start during pregnancy? If prior to pregnancy, it may not be there, and then we find in pregnancy diabetes has happened.
This is very temporary condition, only occurs during pregnancy. Now, in pregnancy, just view it as, a new human is forming in the uterus of this woman. So it is like a transplant. So the whole
Yes.
body metabolism of the mother is affected. So there is reorganization. There are multiple hormones also which are secreted. There is a growth hormone, there is a prolactin. So because of these hormones, the blood sugar increases. If the mother is absolutely normal, if her pancreas or beta cells which secrete insulin, they are functioning normally, the mother will not develop diabetes. It's only 3.5% of them develop this gestational diabetes. Okay. Therefore, sometimes it happens that only during pregnancy the blood sugar goes high. I will not call it as pure diabetes as type 1, type 2. It is gestational diabetes, but after delivery, they should also monitor their sugar, whether the diabetes now has come permanently or not.
Right. Now, what I want to know is that a viewer is asking, I had diabetes in my first pregnancy. Now, will I have a risk of developing diabetes again in my further pregnancies also?
It's a risk factor. So if you have previously if you had GDM in the next pregnancy, you are also likely to have. So before next conception, she can maintain her weight, she can follow her diet, she can do regular exercise. Diabetes requires a very regular lifestyle, regular eating, regular exercise, and all. So if she follows that, the chances are much less. But if not, it's a risk factor. So you can't predict, but it is a risk factor.
And is there a risk that she can develop diabetes later in life also?
That is, it is not uh, exactly proven by research. That's why we ask them to do a follow up. Now, if there is a family history of diabetes in the woman, her parents are diabetic or her siblings are diabetic, then there are chances. So after delivery, after 6 weeks, she should do her blood sugar. That should come down to normal. That means her GDM has resolved. If there is a risk factor like this, some are overweight, so obesity, family history, PCOD, and all these factors, in that case, she should again check her blood sugar after 1 year. If there are no risk factor, then she can check the blood sugars after 3 years. That will tell us whether she has developed diabetes or going to develop diabetes, not before that. So
Okay.
regular
This
monitoring is necessary.
is very important. Yes. Another one also wants to know, will sugar come back to normal delivery after delivery, and how soon?
That's what I said. GDM is only specific, it's a temporary condition, only occurs during pregnancy. So, 6 weeks after the delivery, it will come back to normal. So, she should check
Okay.
her blood sugar 6 weeks after the delivery.
Okay. And what fruits are best avoided by women having diabetes during pregnancy?
What foods?
Fruits,
Fruits.
pal.
Okay,
Yes,
the fruits which are very rich in carbohydrate or sugar are banana, chiku.
yes.
These are the two very rich in sugar. But other fruits which are having more water, like oranges, sweet lime, watermelon, pineapple, guava, all that she can have. She can even have grapes, 8 to 10 grapes, not more, 8 to 10 grapes, because there is lot of water content, less of sugar content, so she can have it. But be careful
Right.
about banana and chiku. About mango, just one piece, because that is also very sure.
Yes. So, another lady wants to know, okay, are there any chances that the baby will have blood sugar levels changes immediately after birth? Should she be
No,
careful?
no, no, no. The baby will be normal. If you have followed this, the baby will be normal. Only thing, take care, because I already told you about the risk factors. Because if there are risk factors in the mother, family history is there, obesity is there, take care that your child doesn't develop what we call it as pediatric obesity. Nowadays, what has happened? Hum do hamara ek, and we have all the concentration on that हमारा एक and उसके इतने लाड प्यार करते हैं जो चाहिए, and particularly trash foods. All our children nowadays, they are so fond of those 2 minutes ka noodles and pizzas and burgers. This trash food is, or junk food as we call it, is the main reason for obesity. So avoid this pediatric or childhood obesity. the child will not develop diabetes unless there are these risk factors.
Okay, good. So that is a very big question solved. And any symptoms from which one can suspect diabetes during pregnancy?
No symptoms.
It is a
Except
symptomless.
you are obese or you had a GDM in previous pregnancy. There is no specific symptom because the blood sugar range is very small, 90 to 120. So there are no symptoms
Hmm,
as such.
right. So a take-home message for all our listeners today.
Preconception counseling. First, be prepared for a healthy parenthood. Get yourself checked, get immunized, and then between 24 to 28 weeks, it is better at 24 weeks you do your blood sugar. So if that sugar is slightly high, immediately measures can be taken and everything will be safe, everything will go smoothly. So don't worry about it. If you take more tension, the sugar will increase.
Yes,
So have a trust in your obstetrician, in your doctor. Everything will go on smoothly with your cooperation. Because medical nutrition therapy, you have to cooperate with the diet that we prescribe. And
yes.
everything will be okay. So don't worry about, like other diabetes. This gestational diabetes is a temporary thing, only occurs during gestation.
So today you have really cleared so many doubts in the mind of young pregnant and about to be pregnant women that they will not be scared at all and they will come forward, get proper things checked up, take immunization, take control of themselves, and then move to healthy motherhood to have a healthy baby. Thank you, Dr. Alka Deshpande, for joining us today. Could you show us a certificate, please? This is a small token from our side, ma'am, to just say
Okay.
thank you for taking out your time. But
Thank you.
your knowledge is par excellent. You are a very good teacher, and I'm so happy and proud to have listened to you today. I think we'll do it more often. Thank you. That will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Thank you. Thank you very much. Namaskar.